Welcome back to the show for Caregivers About Caregivers, hosted by a caregiver. I am Peter Rosenberger, bringing you 3 decades of experience to help you stay strong and healthy as you take care of someone who is not. And we are so glad you're with us. 877-655-6755. And as is our custom, once a month, we have a very special guest. She is our classy Canadian caregiver correspondent, Tracey Maxfield. She is a 35-year-plus nurse with expert care in dementia patients, and she's bringing her ample wisdom to this particular issue for us and gives us lots of practical tips. So, Tracey, welcome back to the show.
Thank you, Peter. How are you?
You know, for a man of my age and limited abilities, I think I'm doing okay. What do you think, John? So I am thrilled to have you here, and we're going to jump right into this issue because I want you to just to vamp with this and talk about this just a little bit. When you have a dementia patient and you have to take them to the emergency room or they're in the ICU, and ICU can breed its own form of delusional type of awareness anyway.
Absolutely.
Talk about that and some tips that you've seen over the years and some suggestions you would have for folks that are dealing with that, because taking somebody with dementia to the emergency room is no picnic.
Not at all. And the interesting thing is that about 7 million people in the U.S. in hospital are going to develop delirium, which is actually quite scary. So delirium, more common in a person with dementia going to hospital because, as you can imagine, unfamiliar surroundings, people they don't know, bright lights, noisy, and they're going to the hospital because they're unwell. So infection in itself, such as a bladder infection, is known to trigger the risk of a delirium. What I would suggest is for any caregivers who has a loved one with dementia is to maybe get a little care package. Think of it as a bag or a box or something that you're going to have things in that you can actually take with you to the hospital if they're going to the emergency department, if they're admitted, or even if they're in the ICU. And in it, you're going to have things that are going to help try and reduce either if they have a delirium or to try and stop the delirium from actually beginning. So you want to have, obviously, the usual medical documents, insurance. You need their list of medications, their allergies, and you also want their medical history, because when someone with dementia goes to the emergency department, or if they're unconscious and go straight up to the ICU, there's no one who's going to have that information. And if you're not able to accompany the person, then make sure the bag or the box goes with that person. Because the person with dementia, if conscious, is not going to be able to answer those questions, and that in itself is going to stress them, and they're going to start exhibiting behaviors and wanting to leave.
So it's basically like having your medical alert bracelet 2.0, you know?
Exactly.
Okay.
Exactly. Also, you should make sure that there's a card or even a letter that the staff can read, which will describe that the loved one has dementia, what type it is, if there's anything that really scares them, any behaviors that triggers them, and things that they like to do. Because if you have someone that's always been a walker and they're in the emergency room and they want to just walk around and see what's going on, you don't want them to come and sedate and restrain that person if this is normal behavior for them. And so by giving them that piece of information, that'll also reduce the risk of the person developing delirium, because medications will trigger a delirium. Restraints will definitely do that, because who wants to be tied down? You automatically go into fight and get so stressed. And because a person with dementia has a lowered stress response, whereas you and I would get very angry but maybe could accept it, they won't understand and they will continue to fight, and they'll start having all different thoughts. Maybe if they were in a war, you can imagine what that could trigger. Also, take their mobility aids. If they've got false teeth, glasses, hearing aid, because they need to be able to communicate. And also put in maybe a favorite pillow or a blanket, a memory book, or a photograph album, because in the emergency room, you want to keep them comfortable and safe, but you want to distract them because it's inevitable. They're trying to make sense of their environment. And you all know in the emergency room, you have pages and buzzers and alarms and lights. And so you want to ask for a private room, or you want to go maybe into a corner which is quieter. Maybe pull the drapes so there's a little bit of privacy. If it's too bright, ask if they can reduce the light. Headphones, noise-canceling headphones with their favorite music is a great tool because that will distract them from all the outside noises and also help them calm down.
You know, by the way, Tracey, let me interrupt there. That's probably a pretty good idea to do with autism patients as well.
Absolutely. And it's actually anyone that has a Down syndrome, anyone that has any kind of cognitive or behavioral challenges that will be exacerbated if they go to that type of environment. It's also really good to use when the person, if they're admitted to hospital and in the ICU, the same thing would apply because the ICU is extremely noisy and that's a very, very scary place. And so if you can't stop the noises of all the various machines, just putting the earphones on and the music can already promote a much calmer environment. Another way is to advocate for your loved one and ask the staff not to use restraints until it's absolutely necessary, to limit the use of sedative drugs and things like Valium, because that in itself creates confusion and drowsiness and also makes the person more inclined to maybe fall or get dizzy and fall out of bed. And I think in the ICU especially, because they're wired up to everything, I think what the caregivers need to do is maybe start having a schedule so there's enough people, maybe friends, family, people from the church who can come and sit with the person, talk to them, comfort them, share memories, go through the memory book, maybe watch something on the television if they're conscious, and try to just keep orientating the person and reassure them. And that's true for anyone in the ICU because 85% of people in the ICU, regardless of any kind of dementia, they can be 19 years old, 25 years old, could develop a delirium just because of the environment in which they are.
Well, and the caregiver as well, too. I've spent so much time in the ICU, and you really become, just as a caregiver, you become disoriented. And your days and nights just get all mixed up, and it's really difficult. So these are good things. Spend a little bit more time with ICU delirium.
So ICU delirium is usually due to the heavy sedation, especially if they've initially put them on a ventilator. If they're unconscious on the ventilator, then really there's not going to be that many behaviors that are triggered. But as they start to come out of that and they're trying to reduce their time on the ventilator, their sedation, they're going to start pulling at the IVs, and the inability just to move and to leave that environment is stressful for anybody. And so that's where the music is helpful, the people at the bedside, the distraction, maybe depending on where the IVs and the cannulas are situated, maybe encourage the staff, instead of restraining the person, maybe to just bandage that arm, or maybe they have a favorite item of clothing that you're able to put over the area so the person doesn't start picking at the area and then obviously create more problems because no one wants to rip out cannulas and create more bleeding and infection. And I think also in the care package that you're going to have, I think it's important that the caregiver has to help them, because you need to be as well rested and relaxed as possible to help your loved one in ICU get through whatever has brought them to that point. So you want to have food and snacks to make sure your medications, and maybe when the person is sleeping, you have a book or puzzles or something that you can do while you sit at the bedside. That with regards to ICU, I think the aim is when the initial emergency is treated and the person is stabilizing and they're planning to move them to the step-down unit, that's when you're going to start working with the doctors to decrease the sedation. Let's try and get them up and moving and mobilizing, because that reduces the risk of delirium, and also try to get them off that ventilator, because there's nothing that person wants to do more than get that ventilator out of their throat, and that creates great panic and fear when they wake up and realize they can't talk. So maybe take a message board or have a computer. If they're able to, they can point maybe to pictures of things or big letters so they can tell you what they're wanting or what their concern is.
Once again, Tracey, you have just really shown why you're such an incredible asset to this show, and we are just so grateful. I do appreciate it. If people want to get in touch with you, what's the best way?
Go to my webpage, www.traceymaxfield.com. And actually on my webpage now there is a contact information, but also there's 27 articles on dementia, or the different aspects of dementia, many of which we've discussed on your show, that they can read up on, print off, and just use it as a helpful tool.
And we'll podcast this out and have it available to folks later on, and we'll post this on all social media outlets. And John and I want to both extend our congratulations for you getting your website. I know I pushed you hard on that, Tracey. And but you are just such a treasure to this show, and thank you for that. That is great stuff. And we're going to talk to you next month.
Sounds good. Have a good one.
All right. We'll see you, Tracey. That's Tracey Maxfield talking about ICU delirium. We're talking about going to the emergency room with someone with dementia and so forth. And did you hear what she said, John? She said, take their favorite pillow. You know, as caregivers, we have to spend a lot of time in the hospital. We have to spend a lot of time in the waiting rooms and so forth, and our loved ones have to go. And you never want to take your pillow to the hospital because it'll get hospital cooties. I mean, really, do you want hospital cooties, John?
No, not really. I mean, there's a lot of stuff going around there.
You know, and so why would you want to take your favorite pillow to the hospital, except if you could wash your pillow without losing the shape?
There you go.
Now, guess who can do that?
I wonder.
Mike Lindell and MyPillow.com. I'm not kidding. I've got 2 of them, and they are wonderful, and you can just throw them right in the washer and dryer.
Hey.
And it's perfect to take because, you know, we have to sleep in miserable places, but we don't have to be miserable. And we can get a pillow, and I don't know if you knew this or not, but if you type in the word caregiver, go to MyPillow.com. Type in the word caregiver under the promo code, the word caregiver, and you get 50% off of the 4-pack and 2 of the Travel Anywhere pillows. So now you have no excuse but to put something nice under your head no matter where you are. And as caregivers, I promise you, you're going to sleep in a waiting room. You're going to sleep on very uncomfortable hospital furniture. You're going to sleep on a hospital room floor. Done it? Have you ever done that?
Oh, yeah.
It is not cool. And who wants to put their pillow on a hospital room floor?
I mean, they do what they can, but it's still a hospital.
But you can wash these and throw them in the dryer, and they never lose their shape.
And a dryer will kill everything.
It will.
Yeah.
And there's certain things Gracie will not let me dry. She just will not let me do it. She said, don't you put that in the dryer. But not in MyPillow.
There you go.
So go to MyPillow.com and type the promo code caregiver, and you can get a discount off of those things. That's pretty cool, isn't it? And also, she said, and I know we got to go to the break here, John, but real quick, she said, take a book. I'm on Facebook Live right now. I'm holding up the book to take.
There you go.
And it's called Hope for the Caregiver. And if you haven't read this book, get it today. You can get it. You can download it, do the e-version. We put the e-version on sale through Mother's Day and Father's Day. And on Amazon, I think it's like $3. It's ridiculous. How do we do it? Volume reading. Volume reading. That's the key, folks. Volume reading. Get this book. Do not be a caregiver without it. There's a reason why it's so many people are reading this book and keeping it by their bedside and keeping it with them in their purse as they go to doctor's office, because it is a companion guide for the family caregiver. HopeForTheCaregiver.com if you want to see more about all that stuff. HopeForTheCaregiver.com. Hey, this is Peter Rosenberger. This is Hope for the Caregiver, and we'll be right back.
Here's some great news. If you missed the deadline to sign up for health insurance, or if you signed up for a plan you're not happy with, you still have a choice. MediShare is a healthcare sharing program. Hundreds of thousands of Christians are part of this. It can save you a lot. Typical savings for a family is about $500 a month. You can join MediShare anytime. It's easy to call and look into it. There's no pressure at all. And man, what a difference it can make. 855-25-SHARE. That's 855-25-SHARE.
Have you ever struggled to trust God when lousy things happen to you? I'm Tracey Rosenberger, and in 1983, I experienced a horrific car accident leading to 80 surgeries and both legs amputated. I questioned why God allowed something so brutal to happen to me. But over time, my questions changed, and I discovered courage to trust God. That understanding, along with an appreciation for quality prosthetic limbs, led me to establish Standing with Hope. For more than a dozen years, we've been working with the government of Ghana and West Africa, equipping and training local workers to build and maintain quality prosthetic limbs for their own people. On a regular basis, we purchase and ship equipment and supplies. And with the help of inmates in a Tennessee prison, we also recycle parts from donated limbs. All of this is to point others to Christ, the source of my hope and strength. Please visit standingwithhope.com to learn more and participate in lifting others up. That's standingwithhope.com. I'm Gracie, and I am Standing with Hope.